Good morning and welcome to Radio Friends on Wednesday, July the 24th. It's a pleasure to have you with us. Now I want to introduce you to Kathy Birkes, first time on Radio Friends. Good to have you here, Kathy.
Good morning.
You are here to tell us about the Midwest Special Needs Trust.
Yes.
What is that?
So the Midwest Special Needs Trust is an organization that serves individuals with disabilities with a particular financial tool, a special needs trust. So we will open special needs trusts, we will administer those trusts, and we will assist individuals in a way that allows them to either receive money or hold money in a trust, and they can continue to be eligible for their public benefits and services.
How do you decide the individuals that you are going to help?
Anybody can contact us. So there's just a variety of services. Okay, so there's so many different circumstances. An individual may have had an injury, and they've been receiving public benefits and public services, and years later there's finally a personal injury settlement. Those monies will then make them ineligible for their public services, and oftentimes the services are only available through the public agencies. Mm-hmm. So we can work with them to receive those monies into a special needs trust. We can distribute that money in ways that are allowable to the Medicaid program, to the Social Security program, and allow them to continue to receive their services.
That's wonderful to hear, because otherwise some of these people would slip through the cracks.
That's right. And the other thing that's important is we can answer the question, what will happen when I'm gone? So we have parents who have children with developmental disabilities. Sometimes, you can figure out plans with family members, etc. But sometimes the best laid plans don't always work out the way we think in terms of who's going to survive who, etc., etc. So it's nice to have an organization that is there in perpetuity to serve them.
You're saying then, if someone has a special needs child and they're concerned about their welfare after they
That's correct.
pass away, your organization can step in and help?
That's correct. And oftentimes, grandparents can do things inadvertently. In fact, that's how our organization started. An attorney in St. Louis, Jeffrey Zaft, had been working in estate planning, etc., and a grandmother had left an amount of money to her grandchild, and it actually made them ineligible for their services inadvertently. They caused more trouble than they really wanted to. So the organization is set up in state statute. So it was a piece of legislation that was passed. The concept of special needs trust is available to anyone with attorneys and with investment planners, etc. But the goal here is to really be available for the lower to more moderate income folks.
Okay. We need to have you come back again and talk more in detail. But I appreciate you sharing this information with us. And if folks, if you want more information, the best thing to do is to go online to their website. It is MidwestSpecialNeedsTrust.org. Again,
correct.
MidwestSpecialNeedsTrust.org, and you'll find all of the information that you need. And Kathy, thank you so much, and let's get another date before you leave here, okay? Now, I want to introduce you to Dr. Farhan Siddiq.
Yes,
correct?
That's correct.
All right. Good to have you here. MU
Thank you.
Healthcare.
Thank you.
And you are a neurosurgeon, correct?
Yes.
You specialize in brain aneurysm.
Yes.
First of all, explain, what is a brain aneurysm?
So brain aneurysm is a disease of the blood vessels of brain, and certain times, for some reason, there are inherent vascular weaknesses in the blood vessels of individuals, and that can then balloon up into an abnormal structure that we call is an aneurysm, and that wall of that vessel is obviously weak. So the biggest fear is that wall can rupture and bleed and can cause a hemorrhage in the brain.
Can anyone have a brain aneurysm, or are there certain people that are more prone to it?
Well, so it's very interesting. So about 5% of population in U.S. has brain aneurysms. A lot of them go unrecognized and undiagnosed because they actually don't cause any symptoms unless they either bleed or they grow very large in size. Now, there are certain predisposing factors that we know for sure, such as prior risk of or a prior brain hemorrhage or prior brain aneurysm, a family history of brain aneurysm. Smoking is one risk factor that keeps popping up again and again in multiple studies that suggest that people who smoke will have more predisposition to having brain aneurysms. Similarly, high blood pressure has sometimes been associated with an increased risk of brain aneurysms.
So how do you treat it?
So there are several different techniques. So I'm a dual-trained neurosurgeon, so I do open surgeries and endovascular, which is minimally invasive treatments.
When you do the surgery, I mean, you're actually opening up the head and working in the brain area?
Yes. So that was a kind of more gold standard traditional way of treating aneurysms. Of course, it had its own pluses and minuses, but over the past 2 decades, or 2.5 decades more so, the newer minimally invasive techniques have come up, and we have done major strides in terms of brain aneurysm treatment. So nowadays, majority of our difficult aneurysms we're actually treating through the groin approach. We go in through a small blood vessel in the groin and
you
have
go in through the groin,
yes,
all the way up to the brain.
All the way up to the brain, absolutely.
And there's a little camera on the end of the.
Right? So we see those catheters on a fluoroscope or an X-ray machine, and so the X-ray machine has different kind of capabilities.
So there's not actually a camera on the catheter that you're sending up.
So eventually, I hope that at some point in our life we'll see that happening, but there is a lot of research. But at the moment, we see them under X-ray, and we have some 3D navigation capabilities through the X-ray, and so that's what we use to see these radio opaque wires and coils to go inside the brain.
That is absolutely amazing.
Yes.
So you're treating a brain aneurysm without doing the
actual surgery.
Surgery. Yep. And the success rate on this is?
Success rates are very high, particularly the newer techniques that have come up, such as flow diversion, and the most latest thing that we really are very excited about, which actually got approved by FDA this year, is Web device, which is also a very small, very interesting device that you actually place inside the aneurysm, and it obliterates the aneurysm from within. So that's absolutely the most impressive thing in our armamentarium. And we have actually, in the Central Missouri, we are the first center that has actually started enrolling patients for this new technique and new.
I appreciate you sharing this information. We're just about out of time.
Yes.
But in 10 seconds,
yes.
Are there any warning signs that you're going to have a brain aneurysm?
So if anybody develops sudden onset of headache, which is not relieving, unrelenting headache, please call or come to emergency room, because there is a possibility you may have had a brain
Okay, if you have unrelenting headache.
Yes.
All right. For more information, Doctor, thank you so much for coming by. For more information, you can go to muhealth.org. muhealth.org. Okay, and thank you. It's my pleasure having you here today.
You're welcome.
Okay?
Thank you.
See you tomorrow. Bye-bye.